Greetings, ladies and gentlemen. My name is Patricia Zide. I am a fourth-year student of Cape Peninsula University of Technology. I am studying Advanced Diploma in Human Resource Management. COVID-19 are a large family of viruses which may cause respiratory infections, ranging from common cold to severe diseases. Diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. COVID-19 was formerly called 2019 nCoV, which was identified an outbreak of respiratory illness cases in Wuhan City, Hubei Province in China. COVID-19 was initially reported to the World Health Organization on the 31st of December in 2019. On the 30th of January 2020, the World Health Organization declared COVID-19 a global health emergency. And on the 11th of March in 2020, the World Health Organization declared COVID-19 a global pandemic. Here in South Africa, as of the 20th of July in 2020, the overall cases has reached its highest, over 373,628 coronavirus cases. And it is the highest volume of confirmed cases compared to other African countries. Gauteng was hit the hardest and registered 136,879 cases. The Western Cape Province counted 85,722 cases, and the Eastern Cape Province counted 65,316 coronavirus cases. In total, 2,505,646 tests were conducted. On the 9th of July in 2020, the total recoveries amounted to 194,865. South Africa is recorded as the highest daily increase in cases of coronavirus. People with COVID-19 have a wide range of symptoms reported, ranging from mild to severe illness. The symptoms may appear 2 to 14 days after the exposure to the virus. It is reported that most people, about 80%, recover from COVID-19 without needing hospital treatment. The World Health Organization categorizes the COVID-19 symptoms from most common symptoms, the less common symptoms, and the serious symptoms. The most common symptoms are fever, cough, and tiredness. The less common symptoms is muscle or body ache, headache, sore throat, congestion or runny nose, vomiting or nausea, diarrhea, and discoloration of fingers and toes or rash on the skin. The serious symptoms is difficulty breathing or shortness of breath, chest pain or pressure, new loss of movement or speech. The main types of COVID-19 transmission in South Africa is first at the household level, whereby the infected people within a household will tend to infect other family members living in a close proximity. Secondly, there is a social space that connects households within a community in a close proximity. A community refers to multiple households living in a close proximity, such as a district or a town. Local stores, shops, schools, and restaurants create opportunities for transmission to occur between households within a community. Thirdly, there are spaces that connect communities, such as places of employment, forms of bulk of transportation, places of worship, places of education, theaters, funeral gatherings, sport events, and major shopping centers. The infectious disease spread between households and communities depending on two factors. The first one is the way in which the disease is transmitted between people, and secondly, it is the dynamics that connect people to each other. More distance naturally translates to a no or a slower transmission of COVID-19. There are ways of preventing COVID-19 transmission. You can reduce your chances of getting infected or spreading COVID-19 by taking some simple precautions. You must regularly and thoroughly wash your hands with an alcohol hand-based sanitizer, or you can just use a hand soap. Washing your hands with an alcohol hand-based sanitizer or soap kills the viruses that may be on your hands. Maintain at least 1 meter distance between yourself and others. The reason why you must maintain distance between yourself and others is because when someone sneezes, coughs, or speaks, they spray small liquid which may contain the virus. If you are too close, you can breathe in the droplets, including the COVID-19. That is if the person has the disease. Avoid going to crowded places. The reason why you must try by all means to avoid going to crowded places is because you may be in close contact with the person that has COVID-19. And secondly, it is more difficult to maintain the 1 meter distance from yourself and others in crowded places. You must avoid touching your eyes, your nose, and your mouth. We all know that hands can touch many surfaces and it can pick up viruses. Once contaminated, your hands can transfer the virus to your eyes, your nose, and to your mouth. From there, the virus can enter into your body and infect you. So please try by all means to avoid touching your eyes, your nose, and your mouth. Make sure that you and the people around you follow the good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue into a dustbin and wash your hands. Remember that droplets spread virus. By following the good respiratory hygiene means that you'll be protecting the people around you from viruses such as flu and COVID-19. Stay home and self-isolate even with minor symptoms such as cough, headache, or mild fever until you recover. Have someone to bring you supplies. But if you really need to leave your house, please make sure that you wear a mask to avoid infecting others. By avoiding close contact with others, we'll protect them from the possible COVID-19 and other viruses. If you have a fever, cough, or difficulty breathing, seek for medical attention, but call by telephone in advance if possible. This will help you, and also it will help others to prevent the spread of viruses and other infections. Keep up to date on the latest information about COVID-19 from trusted sources such as the World Health Organization, Africa CDC, and you can even check on our Department of Health website. The first thing you should do if you discover that you are infected with COVID-19 is to stay home. According to the Africa CDC, most people who are infected with COVID-19 have mild illness. They can recover from home without medical care. Do not leave home and do not visit public areas except getting medical care. It is also very important to monitor your symptoms. You must take care of yourself by getting enough rest and always stay hydrated. Take over-the-counter medicines such as Panado. It will help you to get better with the pain. Remember to wear a mask and always keep at least 1 meter distance from others. Be in contact with your doctor before you get medical care. If you have trouble breathing, then make sure that you get medical care because it is a serious symptom. Avoid public transportation because it increases the chances of spreading COVID-19 to other fellow passengers. Separate yourself from other people and pets in your home as much as possible. Stay in a specific room, and if possible, you should also use your own bathroom. If you need to be around people or animals in or outside your home, wear a mask. Seek for medical attention if you have the following symptoms: trouble breathing, chest pain or pressure in the chest, new confusion, inability to wake or stay awake, or if you have bluish lips or face. Call 911 for emergency medical assistance, or you can call the government-run emergency number for ambulance on 10177. Avoid sharing personal household items, including dishes, drinking glasses, cups, towels, or bedding with other people in your home. When you used the items I mentioned, you must wash them thoroughly with soap and water, or you can put them in the dishwasher. Also, clean the high-touch surfaces every day. Clean and disinfect the high-touch surfaces in your sick room, which is in your bedroom and in your bathroom. And also wear disposable gloves. South Africa will use dexamethasone as a means of coronavirus treatment. Dexamethasone is an anti-inflammatory medication. It is used to relieve inflammatory in various parts of the body. Dexamethasone is also defined as a steroid that has been used since the 1960s. This medication has been listed on the World Health Organization Model List Medicines since 1977 on multiple formulations. This medication will be used for people who are in intensive care, which is in ICU, and also for those who are in oxygen or ventilators. The Minister of Health has also stated on the SABC News that it has improved the lives of those who are in ventilators by around 20%, and it has also improved the lives of those who are in oxygen with around 30%. The good news is that the stock that South Africa has is enough as dexamethasone has been used for decades in the country, also in the other countries for other conditions. Make sure that you have fresh fruits and vegetables. They are very important for your health and for your healing. If you have minor symptoms such as fever, cough, or tiredness, then you should have pain medication, vitamin C, cough medication, and herbal remedies such as turmeric, cayenne pepper, and ginger. Until there is no vaccine for COVID-19, we should continue wearing masks or face coverings to cover our nose and mouth, keeping distance from others, avoid crowded places, and accept the reality of temperature screenings. These precautions will continue to be important because some who carry the coronavirus do not show symptoms. Thank you for watching this video.